delightful speaker that's going to speak while you have dinner. While you're eating dinner, she's going to speak with you about a healthy heart. The girls, I will call on the table, you will go up and the girls will serve you, and then come back down and sit down. Once everyone is seated, then Margaret, this wonderful lady over here, will first of all receive an Academy Award for coming. And second, she'll give a speech. But the Academy Award is something that you'll all want to watch her accept. Okay. Because it's from me. And all of you. So for being so outstanding and being a speaker and being her last public speaking engagement, I thought she deserved to have glow or something. So I decided, thought this looked like Margaret. I love it! I love it! Oh my God! That's the meeting around. Now the picture. Because I love to dress up like this. Thank you. You're awesome. Several years back, and I actually had been over to the Lundberg COA that week, I had just a very odd occurrence where I just wasn't feeling right. And I always say to women, when you don't feel right, something is wrong, because women have intuition. So I actually got up in the middle of the night, drove myself to the hospital, and the very next morning I was in an ambulance to the Brigham and had open heart surgery and triple bypass. And I had no symptoms that are common to heart disease. I just felt different and anxious and not right. I knew something was not right. And I had spent years fighting heart disease because my mother and father both had died of heart disease. And because of that, I was very in tune to the fact that I could have heart disease. So I exercised, ate properly, and my cardiologist said, Margaret, you just are swimming in a shallow gene pool. So you might have delayed the heart disease, but it was inevitable. And even though I stand here looking fairly healthy, I'm still doing the same thing. Once you have heart disease, you have heart disease for life. So it doesn't go away. The heart surgeries that they do, the stents they put in, the ablations they do for atrial fib, it doesn't really take away the heart disease. So you always have to be conscious. And heart disease is the #1 killer of women in the country. It is, everybody thinks it's cancer, breast cancer, and it's not. For a woman, it's heart disease. So I actually, after my surgery and recovery, and I got back to work and was on my feet, I actually was called by the American Heart Association to become one of their Go Red women. And I first said no, and then my daughter said, Mom, you know what? You need to do this because you need it. So if just one woman that hears you speak listens to their body and gets themselves to the hospital, you will have made a difference. So I said, all right, I'll do it. So it's been 6 years now, and I'm still going and speaking. I actually do it for Lowell General Hospital because that's the hospital that I went to the night I drove myself to the hospital. And one good thing that they did listen, because a lot of women, when we arrive in the emergency room, they tend to fluff us off. If a man arrives, no offense to the gentleman in the room, but if you come into the emergency room and you're having heart issues, they're usually pretty apparent. You're having chest pain, you're having trouble breathing. Women don't present like that. They're apt to have a pain in their neck, a pain in their jaw, a pain in your back. It won't be, or just an uneasy, queasy feeling of, I just don't feel right. I feel like something's going on. So what happens a lot is we are diagnosed as having anxiety, and they might just write an Ativan prescription and send us home. And that's why more women die from heart disease, because then you're not apt to go the next time. And you're saying, oh, this must just be anxiety. Less than 10 days ago, somebody that I work with called me and said, I had the worst night ever. I was up all night, and she's 51. And she said, I've had like a little pain in my chest, but just anxious. I said, dial 911 right now. And she's like, no. I'm like, you know what, Amy? Dial 911. She had pulmonary emboli in her lungs. Yeah. So she had a minor procedure several weeks ago, and there was a clot, and the clot actually dissolved in her lungs. So she was in Emerson for 5 days, and is now out for a couple of months for work, because when you have something like that happen, it really will set you back. So I say listen to our bodies. The other thing that people sometimes don't think about cardiovascular disease is stroke. Stroke is also not the number one, but more often than not, when a woman goes in and they do an MRI in her brain or a CAT scan, they will find that there's been some, they call them events. They actually don't even call them strokes now. They say, yeah, you probably had an event. Now, you don't want to ever have an event. You like going to events. You don't want to have an event. Ever. Because that's sort of the new clinical term, event, right? Both of my sons are doctors and my daughter's a nurse, so, to hear their talk, an event, I'm like, I don't want to have an event. And the other thing, too, is that you can't ever underestimate your symptoms. That's the key. And women in particular, that's what we tend to do. And I always get very, very adamant about empowering women when they go to their doctor, number one, to go with a list, write down every single thing. If your doctor's not listening, and I don't know how many here have gone to a doctor recently and felt like maybe they weren't listening, you say, I don't think you're listening to me, number one. And if they still are not listening, what I say is that you need to get another doctor. Because you don't, as we get older, a lot of what happens is things that can be maintained, and if the doctor's not listening to you, you're only going to get sicker. And my youngest son's up at the Dartmouth-Hitchcock up in Lebanon, and he says, Mom, we can keep you alive forever. You don't have to die. But you want quality of life. That's what we're looking for, is the quality of life. And as we're getting older, and as Faith just said, I've been at River Court since before it opened, and I actually just retired from River Court. Not retired from work, but retired from River Court. And I look around and I say, I'm getting older. My husband's getting older and frailer. And what we need to do is to be maintained at a good level. And even when the people move into River Court, we're not going to make people better, but we want to make our circumstances better. so that our life is better. And that's why I've always loved senior centers. And Lunenburg, over the last probably 20 years, has been my favorite. So, my favorite senior center. I just have to pick up my glass. I love the people that work here, and so I don't know if you know this, but when I went out and I was out sick, Faith covered me at River Court.
Oh my.
Did anybody know that?
No.
Yeah.
It was a good substitute.
Yeah, and they loved her there, but unfortunately I came back.
Near the water.
Okay?
Near the water.
2/3 of every woman that dies of a heart attack has had no symptoms, none. They just die. They just go down and they die. So that's something to really think about. Now, my main artery in my heart was 99.9% blocked. And I was still functioning because the other arteries, women's bodies operate different. If a man's body is that blocked, they're on the ground. But a woman, no. Totally different event. And that is why Macy's has become the sponsor of the Go Red campaign. So if you go to Macy's with your red pen, you get 25% discount in February. Yeah.
It's almost over.
Oh, good. It's almost over. Okay.
Oh gosh, we better hurry up. Right over there.
The thing I worry about most of all, and I will tell you that because heart disease in women has come to the forefront, cardiovascular disease includes stroke. And the main thing we have to think about as adults, older adults, is stroke. None of us, anybody here have a stroke ever?
Oh God.
No? Yep. Or TIA, which are, you don't sometimes even know that you've had them until they do an MRI. And TIA are what they call mini strokes in the brain, but they're also, that is part of cardiovascular disease. And it's all tied in together, which is why they give you Coumadin, or does everybody or anybody here take aspirin? Every day a baby aspirin? Yes. Yeah. Because that's really very, very good to do. Because it does. The first thing they do in the hospital, if they think you're having anything, is give you a baby aspirin to chew.
Yeah.
They'll give it right to you. Chew up the baby aspirin. And why the baby and why the chew? Because if you take a whole aspirin, or even if you take the little quarter-sized one, it takes time to dissolve. But if you chew a baby aspirin, it goes right in. So, you know, if you ever feel like your vision is blurry, do you know the symptoms where your face may droop? Yeah, your arm might feel weak. Yes. So anytime you do that, take aspirin. Take aspirin down 911, but I say take the aspirin if you have. I keep aspirin on my counter. I just think it's a very good basic tool. Do you know if they tried to put aspirin on the market today, it would take years and it would be a prescription. That's how strong. Because it can dissolve your blood. Think about it. It's like Coumadin or Xarelto, you know, the new one that they don't test. You don't have to have your INR tested. So, I mean, an aspirin is a very, very powerful drug. Well, I was saying my husband's on Coumadin forever. He has a defibrillator, pacemaker. So my children live in a very bad gene pool because of mother and father with heart disease. So it's, you know, they're very cautious. Watch their diet faithfully. Oh, and the other thing with especially women is that I have great cholesterol, So how many here have good HDLs? HDL is good cholesterol. That's the one you want to have high. Mine's like 125 and has been. And how many are on Lipitor here? Lipitor? Yeah. Crestor or some sort of drug that, yeah. Women present differently. I had my cholesterol done in March. My cholesterol was perfect. HDLs were 115, which is off the charts. LDLs, super low. Triglycerides, perfect. And my arteries were all closing down. So that was because I'm a runner and I exercise. My other arteries were pumping the blood harder and faster. But I was, as the doctor said, 6 hours, 6 days, or 6 weeks from death.
Oh my God.
So you really, if you're not feeling right and you know it, you have to absolutely take charge of yourself. And unfortunately, in this world of healthcare that we're in, I don't know if anybody's been to the emergency room lately, but I gave this talk in Bill Ricker, at the Bill Ricker COA a few weeks ago, and I heard so many horror stories about ERs. And what it is the minute you are, does everybody here understand observation too when you go in the hospital? Faith, have you had anybody talking about that? Okay, there's a whole new drama within hospitals where my husband was in when he had his defibrillator and pacemaker put in Lowell General for 4 days, 5 days, 4 nights, under observation. So he never was admitted to the hospital. We knew that because we asked, but any time you go in the hospital, you say, when they take you to a floor, am I being admitted or am I under observation? Because if you're under observation, and even if you're there for the standard 3 nights, 4 days, go into rehab, if it's observation, you're not going to rehab unless you're paying it out of pocket. So you need to, that's my new campaign, is when you get to the hospital, you say, am I under observation when they're bringing you in? Because if they say, and you know, you could be on the floor in a hospital under observation and the person next to you is not. It's not necessarily where you are in the hospital. So if they say observation, you also have a right to challenge it and say, no, I want to be admitted. Because when you're under observation, even the medication they're giving you costs you more. Because you're not in the hospital. But you also have the right, under observation, to bring your own medicine with you. And they never tell you that. But you can bring your medicine. So I just brought Bob's from home because it was good. His medicine bill was going off the charts. So there's so much going on in healthcare that we can't keep up with it. And especially if you have any heart issues, you are very apt to be put into observation with heart issues. Your insurance will pay, Medicare will pay for observation, but it's billed differently, so they're not getting what they would get.
Margaret,
Yeah?
they're under observation at Luncheon Hospital.
Oh,
Okay?
because Bob's was paid.
I can tell you right now that they need to say, I need to be admitted. Otherwise, you will end up with a large hospital.
Yeah, the hospital, you will get a chunk, but they will pay some of it.
It will be very little.
Yeah. Mm-hmm.
So you must say when you get there, I need to be admitted, not
And they can refuse to.
Yeah.
Admit you. Yeah.
You can also ask for the bowel.
Yes, exactly. So you have to, you know what I say when you go to the hospital, never go alone. If you cannot go alone, okay, that is really, really important. Okay, and I'm just going to run my numbers. Total cholesterol, 200 is the magic number. You want it under 200. Your LDLs, L think of lousy, because that's the bad. That needs to be under 100. Your HDLs, 60 or higher. Triglycerides, huge. Triglycerides play a huge part in heart disease. Huge, huge, huge. No one usually asks about them. 150 milligrams. You don't want it anywhere less than 150. Okay? And high blood pressure?
Why do they keep changing the number?
They always do, yeah. You know what? If I could have taken everybody's blood pressure here when I came in, and within 5 minutes, redid the entire thing, it would all be different. It would depend on who you saw, how you started talking, you saw somebody you liked, somebody you didn't like. Everything changes. It changes that fast, which is why they tell you to take your blood pressure at home. You know the little blood pressure cups?
Yeah.
Excellent, excellent, excellent. And take it, because that's the best way to monitor. You go in a doctor's office, that's not a true blood pressure. I mean, how many have what they call white coat hypertension? You see the doctor, oh, you're waiting an hour, by the time you get in there, and I always say you're always waiting for bad news at the doctor's. No one's waiting for good news. Always. So you really, the doctor is going to tell you something you probably don't want to hear. So the longer you wait, the blood pressure goes up, and it just does. So that's why I take it at home. Doctors love it when you come in with a blood pressure card. Do you have blood pressure cards here? And dates and times, and that tells them more than in the office. That's not a good, unless it's super low. That would be a whole different ballgame. But blood pressure is very, very hard to monitor in a doctor's office. Now, everybody thinks that you can tell when you have high blood pressure, but you really can't. You just can't. Normal, this is their 120 over 80 is normal, if there's such a thing as normal. Now, hypertension, it's going up. 120 to 140 over 80 to 89. That's considered at-risk hypertension, as of last night. Okay, high, 140, anything over 140, over 90. And that bottom number is super important. It's the diastolic. I always say it's diabolical, because the higher it gets, the worse off you are. So, you go up over 90, and you could be over 90 in the doctor's office. Yeah, without a doubt, you could be. So you really have to be doing it at home. And I'm not sure, and Faith, are they able to get blood pressure if they couldn't afford one?
Blood pressure screening is once a month.
Oh, okay.
Once a month, they can bring up blood pressure screening.
Okay. And I just actually went on Medicare, so I'm having Medicare 101 training right now, and it's just not a picnic. Yeah, so I'll tell you, it's very interesting to have a new Medicare world of healthcare. It was one of the reasons I stayed working as long as I did, was to avoid Medicare. So, because I know how limiting, and no matter what they talk about and what our candidates are saying about Medicare or Medicaid, or it's not good. And I work in the field and have worked in the field forever and understand the terminology, and still it's very, and as soon as I think I understand everything, I get a letter in the mail. A letter saying, oh, no, that drug's not covered, you know. Or because I actually had one drug was $132 for 30 days. I'm like, what? It's a tier 4. I'm like, okay, well, I'll get a generic. They don't make generic. I said, I've been on this drug for like 30 years, and now there's no generic. Because after 10 years, there's supposed to be a generic. There's no generic.
There was a guy that owns that.
So it makes you wonder about that drug that fellow was charging $700 for. Yeah. Heart disease, anything heart related, your heart is really what governs your whole body. So, you know, without that blood flow throughout your body, you're not going to be able to function. So it is a fragile part of who we are. Did I hear you say the brain too?
Yeah.
Yeah, in our brain, of course. But the brain can't function without the heart. And the heart can't function. The heart can, you know, I have to tell you, because I went on the heart-lung machine after my surgery, and it's amazing. And that's when I was just blown away by the whole process. And that's when my son was down there kind of overseeing everything that was happening in there. And that's when he said, you know, so what I also say is to make sure that if you have a heart attack or a stroke and are incapacitated, that you have the necessary documents in place for somebody else to carry out your wishes, because that's very important. And you carry it in your wallet, your name of your healthcare proxy and your power of attorney. Very, very, very important that they know exactly what you want done. Because, again, they can keep you alive. But I know my wishes are, if I had a stroke and was incapacitated, I want to be let go. And so then I have 3 children, and I sit down and say, who of you 3 agrees with that type of thinking and will be able to do it? Because that's a big, heavy decision. If your children can't do it, I actually, this past winter, was my very, very best friend had a brain tumor, and I was her healthcare proxy and her power of attorney. And it's very difficult to let somebody you love go. But I knew I was carrying out her wishes. I think it's the most important thing we could do. Have you ever seen the 5 wishes? Did you do that? Ever have that form here?
That's great.
Which is wonderful, because it explains perfectly what you want and do not want in the case of, say if during my surgery that you stroke, because that's a very common thing that happens in heart surgery. They will come out to the family and say, Margaret had a stroke. We expect that there's catastrophic brain damage. Who is the healthcare proxy here? Because you really need your healthcare. And what would she want done? Not what that person wants. What has she expressed? If you don't have a healthcare proxy, they will keep you alive. And you'll just keep on beating. And it can end up in court with the family at odds, because not everybody is on the same boat when it comes to letting people die. And it is also a religious thing that can come up, and it's pretty, my friend that died, I was her healthcare proxy because her sister would not have been able to let her go, but the sister sued me. I had to go to court with the team, the hospice team, because she claimed we killed her. So, but that's how it can get. So I always say, write everything down that you wish. And as we get older, it's the most important thing we can do. For our family, for our spouses, I always say spouses are not the ones that should be making that decision. I am not my husband's proxy and he is not mine. Because I think when it's too close, and if we had a fight, I might just say, watch out here, right? Just, yeah, on today, yeah, we can let him go, but then tomorrow, maybe not. So, but it's somebody else, somebody that is maybe even your sister, somebody, and also somebody that has a little healthcare knowledge. And it's getting more and more difficult, and the primary care physician actually is almost going away because there aren't, number one, their reimbursement, and what the primary care or family practice doctors are saying is, we don't want Medicare patients. I hate to say it, but that's what they're saying. My son actually practiced, he went to school in Boston, and he was at the Beth Israel, and with the Brigham and the whole 9 yards. And the reimbursement from a Fallon Medicare claim was, by the time the profit, was $13. Oh my God. Think about $13. Now, I have a very strong theory about what we should do. And again, now I am in the Medicare mix, and I'm really looking at it very closely. Your best friend, and all of our best friends, is going to be a nurse practitioner, because they are going to be the front door to get to a doctor now. We are not going to get to the primary care physician. But nurse practitioners are incredible. My daughter-in-law, both daughters-in-laws are nurse practitioners. And they will spend time with you. And the doctor bills the nurse practitioner as his billing hours, while he maybe would see a sicker patient. But all of them, at Neshoba Hospital, they're going the route of nurse practitioner. You're going to see nurse practitioners there. And of course, your primary care doctor does not follow you into the hospital anymore. It's a hospitalist. And that hospitalist will be sending you out. And his directive is to evaluate what happens in a hospital. I actually saw a client before I got here, and her aunt went to Emerson, went in perfectly fine, had a rotator cuff surgery, and is now at Life Care at Acton, totally demented. Something happened. They said it wasn't a stroke. And I don't know if anyone around here remembers Dr. Asher.
Oh, yeah.
Well, Dr. Asher is the director over at Life Care Acton now, so that's a good thing. So I said, I put my name and I said, please go talk to him and have him, and that could be, she could have had some oxygen loss to her brain during the surgery. She could be dehydrated. Dehydration causes dementia. There's a host of things. She had no dementia before the surgery. UTI, there's another huge risk. So she was writing it all down, and she was going over this afternoon. And I said, ask to speak with Dr. Asher, because he was like my favorite doctor when I first came out of this area to work. And, he had some little edginess to him. But he was a great diagnostician. Great diagnostician. He gave up his practice because it was taken over by the hospital. I will tell you that Neshoba Hospital has some excellent new primary care doctors. And they would come over here, Faith, and talk if you wanted them to. I really met two of them. They were lovely, and they actually have a new female cardiologist.
I had 3 cardiologists in 3 months, and they all
That in the show book.
disappeared.
Yeah, you know what it is, because they don't pay them enough.
No, they're
I
gone.
go to
They're in and out.
Lexington. I have a nice PCP in Lexington.
But you have to leave here and drive to Lexington.
Yes,
So-
but it's worth it.
It's worth it, yeah. And you know, your ambulance is going to take you to the closest hospital.
Yeah.
Just remember that. They will not drive by a hospital. They will take you to the hospital. So, and I think I'm getting the signal.
Another question.
When you talk about a cardiologist and you said I've seen 3, you should see at least 5. You know why? Because most of the time it's a team.
Oh, yes.
Okay? If you've got a team that's working on you, you've got 5 minds working on that same subject, not just one that's maybe old and blocked.
Yeah, but I had to pick a hospital, that Luncheon hospital, they had 4.
Yeah.
And they wouldn't let me have 4. I had to pick one of them.
Well, you pick your team leader.
Right.
But other than that, there is a team. Each doctor now, especially at Leominster Hospital, because of your math, okay, has a team. Whether it be dermatology, whether it be cardiology, whatever it might be, they have a team.
Well, it's good to know.
We
Yeah,
had
it's
Dr.
good.
Hersey at Emerson. He was nice.
He has a team.
Yeah, he's nice.
They have, the closer you get to Boston, the bigger the team is, because especially if you are at a teaching hospital. If you're at UMass, that's a teaching hospital. If you're at Mass General, that's a teaching hospital.
Oh, yeah.
They have teams. That's the only way you can teach students how to become doctors that you want in your community. And there's not going to be any GPs. It's going to be a family physician or a specialty.
Yeah, this one. Well, thank you very much.